Dr. Thomas Farley. Good morning, Dr. Farley.
Good morning.
So let's begin. First of all, how many doses of vaccine have been delivered so far to the city, and how many people are you aware of have been actually vaccinated?
We have over 70,000 doses that have been allocated to the city. Now, some of those have gone to nursing homes and some have gone to hospitals to vaccinate their staff. And so far, we have documentation of about 27,000 people who have been vaccinated with that. So it's about 40%.
So far, are you satisfied with the speed of the vaccination process? I mean, that's about a third right now, a little bit more than a third.
Of course, we'd like it to be faster, but I think that, people had maybe unrealistic expectations about how quickly this vaccine would go out. It's a pretty complicated process, especially with these vaccines have to be stored at certain temperatures. And we want to make sure that they're getting into the arms of the people who would have the greatest impact on the epidemic, those who could die from it or those who could pass it on.
So let's
do better, but I think it's not a bad start.
Yeah. So let's talk about who's the next group that will receive the vaccine. So, and how do you prioritize that? Is it a national list, or does each state or city make up their own lists?
Well, there are national recommendations, which we are generally following, and then we have a local advisory committee that will help us fill in the details beyond that. But so far, we're still on the first group, Group 1A, and that's healthcare workers and people who live and work in nursing homes. 1B is going to be probably weeks away from this, and that will probably include what we call frontline essential workers, people who are exposed to lots of people day in and day out. But we're going to work out more details on that later.
When do you anticipate the general public being eligible to get a shot, and how's that going to work? Will there be mass vaccination sites, like New Jersey has a few large places that they're putting into effect? And what's the process going to look like? Are you going to sign up like on a website and get an appointment?
First, I want to set some realistic expectations here. This is going to be months before we have enough vaccine out there to vaccinate just everyone in the population. A very small number of doses out there per week. As far as how it's going to be available, we'll use a combination of different approaches where we'll make it available in healthcare facilities. We may have some mass clinics set up, maybe somewhat like testing now where there's a combination, as well as pharmacies. But we're a ways off from being available to everyone.
So switching now to indoor dining. It was allowed to resume in parts of Pennsylvania, outside of Philadelphia yesterday. Philadelphia restaurants need to wait a little longer because the restrictions are currently in place until January 15th. Right now, looking into your crystal ball, does it look like the city is still on track for that date?
Well, I can't say for sure. I am concerned that we are seeing increases related to Christmas. We've seen sort of an uptick in the city of Philadelphia, more rapid rises in the suburbs around this, and then big increases across New England and New York and across the country as a whole. So we're very worried about where this is going to go. We're going to have to watch this over the next few days to determine if they can open as of the 16th of January.
How long does it take to see a spike? Like after Thanksgiving, was it 2-3 weeks afterwards that you suddenly started seeing a spike?
Well, we started seeing it about 5 or 6 days afterwards, but then it takes us a couple of days for the data to get in. And it lasted a good 10 days to 2 weeks after that. And so we still haven't seen, I don't think, the full effect of Christmas, and we definitely haven't seen the effect of New Year's yet.
Well, finally, sir, as we move forward into 2021, what continues to be your message to people around the city?
It's very exciting that the vaccine is available, but this vaccine is going to trickle out over a very long period of time. So we're still stuck with the basic tools we've had for months, which is social distancing. So wear a mask whenever on anyone, and don't gather with people outside of your household indoors.
Well, Dr. Thomas Farley, we appreciate you once again joining us this morning.